Thank you very much. It's great to see so many people, actually. I have to say I wasn't expecting quite so many, so that's very flattering. It's good for my ego. Some of you may have met me already. I gave a series of lectures on animal behaviour last year, and I want to talk to you today about something that's actually a little bit closer aligned to my professional interests. I'm actually an anaesthetist. I used to work a little bit more at the Hospital for Small Animals, and I now work over at the Roslin Institute, where I anaesthetise laboratory pigs. And you're probably looking at the title of my talk and saying, why on earth someone who deals with pigs, why has she come to talk to us about pain assessment and management in unfamiliar vertebrates? But actually, I can tell you there are quite a lot of similarities and quite a bit of overlap here. So pigs have been domesticated for 15,000 years, and we are still terrible at assessing pain in them. We've got no validated pain scoring system for assessing generalised pain in pigs, and it's very hard for us to even start to see the signs of pain. But even so, 15,000 years we've had them domesticated. I want to talk to you today about the problems inherent in pain assessment and management in species about which we know far less. So, the aim of my talk, I want to talk quite a basic overview in terms of the controversies about pain, why people are more or less likely to perceive pain in animals, and the difficulty that engenders in trying to manage it. Secondly, I want to give you a framework for assessing pain. So talk about what is out there, how you can start to think about assessing pain in unfamiliar species, but also if there really is no information, where at least you can make a start. Thirdly, I want to give an overview of analgesic classes. Now, this is not an anaesthetic lecture, so it's going to be fairly concise, but just to give you an idea about how you can move down the rankings when you're thinking about different analgesics to use. And finally, we're going to have a bit of a discussion about some of the ethical problems inherent in trying to treat pain in animals where we really can't assess it. What this talk cannot do, however, is give you a species-specific overview of pain management in all non-domesticated vertebrate species. I think that would be many lifetimes of work. So I'm going to start with a rather cliched quote, and I'm sure you've all seen it before. I want to highlight, however, what aspect of this quote means that the definition of pain perception can be a little bit controversial. Basically, pain is an unpleasant sensory and emotional experience. And this concept of emotion is really very crucial to how we define pain and the sort of higher pain, emotional pain in animals. So, for example, some people would say that fish, just to take an example, will recoil from an unpleasant and a so-called painful stimulus. But that might just be a reflex. There's no higher processing, and the fish doesn't actually find the experience particularly unpleasant. However, there is a growing body of information that does suggest that, rather unsurprisingly perhaps, fish do not like being injured. And it's that concept of liking, of having an aversive or otherwise experience that's very crucial to our definition of pain. So, this is also a subject of substantial public interest. So I just ran a quick search to look for news articles discussing papers where people claim to have proven that definitively that a class does or does not feel pain. But you can see that it is of quite a lot of interest. People want to know whether animals are suffering in terms of producing their meat, in terms of being their pets, in terms of even being used in scientific research. There are various things that can affect how we judge pain in animals and how likely people are to see or not see pain. One of the biggest steps forward in animal welfare in the last 200 years was the sort of anthropomorphization of animals. So actually, I found this really interesting. One of the most useful points was that authors started to use animals as protagonists in stories. So things like Charlotte's Web, Taka the Otter, Black Beauty, all of these stories where the animal was suffering, was experiencing emotion and feelings and pain, these helped to prime a generation of children at that very young age to think that animals did have the capacity to suffer. So that anthropomorphization has been very important historically in our ability to perceive and therefore to decide to manage animal pain. There are various cultural beliefs as well that may make people more likely to give animals the benefit of doubt regarding pain. Many of the major world religions say that we have a duty of care, that we should be protecting animals. And so that is going to influence people's thoughts on how to manage pain. In addition, there's legislation, the Animal Welfare Act, the Animal Scientific Procedures Act, in the UK alone, and there's obviously wider animal welfare legislation. So if governments are seen to be legislating to control pain in animals, again, that creates the expectation that pain is perceived, is felt by animals. However, there are also things that are going to make people less likely to be able to recognise pain. What this talk is going to mainly focus on is the difficulty in measuring pain in species that we're not familiar with. However, there are cultural beliefs, perhaps that man has more dominion over animals, that animals are not as important, and therefore their feelings are less prioritised than humans. These are not going to help people to decide and see pain in animals. In addition, there are conflicts of interest, so especially in the fish pain debate, which has been and still is ongoing. Quite a lot of the work comes from a guy who takes funding from the angling industry. It may not affect his scientific judgment, but you still have to always take these sort of findings with a pinch of salt where there are hidden agendas, because people may not wish to believe that what they do for fun is actually causing pain in animals. So it's easier to try to prove that they don't feel pain. So, I'm going to start talking quite a little bit about prey species now. And that's because if we think about the sort of hierarchy of ecosystems, most of the species in the world are going to be prey species. So they're going to have to prioritise survival, not being hunted, not showing weakness quite highly. This differs from the animal that we know best, the dog. So why is it so easy to see pain in dogs? Dogs have been domesticated for 100,000 years, and their evolution throughout this time has been improved. Their selection and survivability is improved by their relationship with humans. So it's advantageous for them to be able to show pain and show suffering to the humans that they work with, because it makes it much more likely that they're going to receive treatment and they're going to receive care. And so those animals are therefore more likely to survive. In addition, for humans, our survival has been enhanced by our relationship with dogs. That's what some of the most up-to-date research is suggesting. So it's been advantageous for us to use them in terms of utility, but in terms of guarding homes, also in terms of companionship. So therefore, if we have a relationship with a dog, it's in our interests to be able to read that animal and to work more effectively with it. So actually there's this really complex evolutionary kind of co-evolutionary relationship between dogs and humans, which makes it much easier for us to be able to see pain. This relationship really is unique. So if we're thinking about cats, if we're thinking about horses, there's no other species that we have such a close bond with. So dogs are much easier. When we start to think about pain in prey species that we are less familiar, we don't have this kind of co-evolution with, it becomes much more difficult. So here we've got a little rabbit sleeping in a towel. How can we tell? Can we tell if she's in pain? Can we tell if she's not in pain? Can we tell if she's not showing pain? It's actually very difficult to tell that from this photo. Why is it so hard to see pain in prey species? Two major reasons. Firstly, we haven't got this co-evolutionary response. It's been of no evolutionary significance to us over the last 1,000 years to be able to see pain in a rabbit. Usually they're probably dead, or you want to eat them. So actually seeing them suffering as well, probably not going to make your meal any better. Secondly, it's very important that they don't show signs of weakness and show signs of pain, because that might make them more likely to be taken by a predator. So not only are we worse at seeing it, but they also show fewer signs. So let's have a look at this little grey rabbit again. I want to show you the photo from which this little clip was taken. And if I tell you now that this little rabbit, the little grey one on the side, she's 4 hours after her spay, she is fully recovered from the anaesthetic, and this little black rabbit here is her companion. Suddenly, when you start to compare the differing behaviours of these two rabbits, you can see there is actually quite a substantial difference. But just seeing one in isolation, you would really struggle to make that judgment. We're going to talk a little bit more about this later on. So, when we have situations where we have inflicted a painful procedure upon an animal, but we don't actually know whether or not the procedure has been painful. So we haven't got any scientific evidence to say, yes, this is painful, no, this definitely isn't painful. This is when we need to use the precautionary principle. The precautionary principle in animal welfare is frequently used in decisions about farm animal welfare. When do we use it? We use it where scientific information is insufficient, inconclusive or uncertain, and where there are indications that the possible effects on animal health may be potentially dangerous. So, to summarise, we use it when we can't prove that something won't cause pain. So what is the precautionary principle? The precautionary principle states that the lack of full scientific certainty cannot be used as a reason for postponing measures to prevent damaging effects. In terms of animal welfare, the precautionary principle provides animals with the benefits of doubt regarding suffering. So again, basically, what is the precautionary principle? If you're in doubt, assume the worst. Assume that a procedure is likely to be painful. Now, the next slide, I want to show you what can happen when the precautionary principle is not employed and what can drastically go wrong. So this paper was a seminal paper by the authors Anand and Hickey. It was published 6 months after I was born, 28 years ago. Prior to this paper, it was common routine for neonatal infants, human infants, to have open heart surgery without anaesthesia and without analgesia. I find that pretty shocking. 28 years ago, that's nothing. So the thinking behind that was that perhaps a neonatal infant would not have the maturity of the brain, the ability to form memories, the concept of pain, the processing of pain, and therefore somehow it became common practice to not use anaesthetics, not use analgesics, just to prevent the side effects, of these drugs. So the babies would be paralysed with a neuromuscular blocker and have oxygen, and surgery would be performed. I highlight this article to really impress upon you the importance of the precautionary principle when you're deciding whether or not something causes pain. So, let's move on to thinking more specifically about pain assessment, why we do it, how we do it. A lot of you, I guess, are probably interested in exotic animal pain. Maybe you want to become small animal vets. Maybe you've got an interest in animal welfare. So why do we assess pain? As vets, we have a duty to prevent suffering. And this becomes a little bit awkward with unfamiliar vertebrate species because you're kind of weighing up two sides. On one side, there are increasing numbers of exotic pets. And there's an increasing drive for veterinary intervention and demand for veterinary intervention. Some of these animals are very expensive. Owners can have very strong attachments to them. But on the other hand, we've got a very limited evidence base for pain behaviours in animals. And this means that not only are there very few licensed drugs, how do you license a drug if you can't tell whether the animal is in pain or not? And even if the drugs haven't gone through the licensing pathway, there's actually just very limited evidence for analgesic efficacy when we can't really tell whether an animal is or is not in pain. So, I want to show you this video here. Last time I showed this, the volume was on 180%, and I almost deafened everyone, but I have checked it first. So. Makes pretty uncomfortable viewing, doesn't it? So, how did you all assess pain? I very much doubt that you were thinking your way through the Glasgow modified pain scoring system. Rather, you're probably likely to have used some fairly instinctive decisions in this respect. So did you see an unfamiliar behaviour? I haven't seen a comfortable, relaxed dog doing that before. Did you recognise pain behaviours, perhaps from teaching, perhaps from your pain scoring system? Oh, that vocalisation doesn't sound very, very happy. Perhaps you saw similarities with human pain expression. Looking at the dog sounds like it's screaming in pain. Perhaps you looked at the environment of the animal. You said, what is the probability that animal is painful? I can see it's got drains and it's got multiple peripheral and central lines. It's having a procedure done that seems to be aversive. How about if I give you some background? How about if I tell you that this animal was 72 hours after a necrotic gastric dilatation and volvular surgery, and it died 24 hours later? All of these add up to an ability, an unconscious ability in that 15-second video for, I would hope, the majority of you to say, yes, that dog is definitely in pain. That's how obvious dog pain is. you can start to see the difficulties when we start to deal with animals where we have a lot less ability to recognise it. So let's think a little bit about species unlike the dog, where we have to be more formal in our assessment of pain because we don't have any instinctive ability to recognise pain. So the sort of gold standard system we have is a pain scoring system. And basically what this means is that a population, a sample of the species that you want to look at has had an unpleasant procedure done to it, and the ranking of the severity of pain that the animal is experiencing with the symptoms that it's showing, possibly in combination with physiological data, is used to produce a kind of hierarchy or a scoring system, which then can be applied to other individuals of the same species. And the validation comes from applying that pain scoring system in a number of different situations and saying, yes, it does seem, these behaviours do seem to correlate with increased severity of pain. This is really good where we have it. This is, this is probably the most evidence-based way of assessing pain. We have these in some species, cats, dogs, quite a few laboratory animal species. So if you are looking for information, don't restrict yourself just to the pet literature. Look at the laboratory animal work as well. However, if you look at the number of species in the world, there are very few that have pain scoring systems. So what else can we do? We can do a pre- and post-procedure behaviour comparison. So if you have an animal brought into you and it's nice and healthy, and then you're going to do something unpleasant to it, you can look at it before and you can look at it afterwards, and you can have some degree of comparison. How about if the animal is painful when it's brought in? You can't really compare with the pre-procedure behaviour. So that's when assessment by a familiar observer who knows that animal is really going to come into its own. You can see, however, there are likely to be a lot of problems with this, a lot of confounding factors. So effect of the surgery, effect of the anaesthetic, effect of the unfamiliar environment, unfamiliar handling, etc. But still, these are methods, at least, of trying to ascertain what the effect of an unpleasant procedure you've done on an animal actually is. So let's talk a little bit more about pain scoring scales. There are various types of scales. The most simple is a visual analogue scale. So basically you have a 10 centimetre line and you mark along that 10 centimetre line where you think the pain of the animal is, from no pain to pain as the worst possible pain you can imagine. It looks very simple, but actually if you always have the same observer, it's got reasonable validity. But the problem is that between different observers, it's not particularly useful. The numerical rating scale is just one step up, so instead of just having a 10 centimetre line, you just have it marked off with centimetres and numbers, and then you can allocate a numerical score. Many of you will be familiar with composite scoring systems, and these aim to kind of formalise your assessment of pain, to make you look at different aspects of that pain in order to assess the animal globally. So you may be familiar with the Glasgow Modified Pain Scoring System. This is a feline pain scoring system. And these are probably what are most widely used in domestic animals and in small animal hospital. There are others actually, so grimace scales are growing in popularity in small laboratory animal work. And these can be really very useful. Let's have a look at this little rabbit down here, we can see that a non-painful rabbit has got quite wide ocular apertures, and then as the pain increases, the eyes close further and further. So if you think back to that little grey rabbit at the beginning, you can suddenly see that there's actually quite a lot of overlap there, and that is a well-recognised sign of pain in rabbits. Grimace scales are fantastic if the animals have muscles of facial expression. And actually that really is just the mammals. So grimace scales are good for small mammals, or for mammals generally, but not really applicable to any of the other vertebrate classes. So the Glasgow Modified Pain Score, although that applies to dogs, you could actually use the headings if you really are trying to work out a slightly more formalised method of trying to assess pain. You could use the headings and see if you can assess behaviour in these categories. You've obviously got to take it with a pinch of salt. A lot of animals won't vocalise. Some prey species may prioritise mobility above everything except a completely dysfunctional leg. If you have a wild animal, the response to touch is going to be very different from that of a dog. But even so, at least you have a few headings that you can start to kind of build a framework for assessing pain. However, I don't want to make this sound too easy, because if we look at how good we are at assessing pain in familiar species, the results are still pretty shocking. So if we ask vets whether in practice, whether they're likely to provide analgesia and how much analgesia they're going to provide to dogs and cats for the same procedure, not side by side, otherwise that really would skew your results, but reliably, vets will say that they will give more analgesia to dogs undergoing the same procedure than they will cats. Do I think that cats feel less pain? No. Do I think that cats are sort of less good at showing pain that we can recognise? Yes. And if that's the case for an animal that's the most common pet in the UK, then our ability and likelihood of providing analgesia in other vertebrate classes, statistically, is pretty poor. So, no point in assessing pain unless you're planning on doing something about it. No one wants to know how painful an animal is. What we want to know is whether it's painful, what we're going to do about it, and then how we're going to manage it further. So 3 steps: assessment of pain, treatment of pain, so how is my animal painful, what are the behaviours it's showing? What am I going to do about that? And when I've tried something, review, really important steps. So it's no good just going, dog's painful, going to give it some methadone, I'll come back in 4 hours. No, you need to keep an eye on it. Is that sufficient? Is that enough? How is my dog doing? It's exactly the same if we were doing it with an exotic species. So we want to be always thinking about the effect of what we're doing and the effect upon the animal. So let's move on a little bit to thinking about pain behaviours in different vertebrate classes. Now, this is something to think about. Which, in your minds, of these classes feel pain? Mammals? Is that all mammals? Birds? Reptiles? Amphibians? Fish? I realise that fish are not a class on their own. I'm including the jawless, cartilaginous and bony fish because there is so little information on any of them, we might as well call them all fish. How about cephalopods, things like octopodes and squid? The reason that I picked these out, as some of you may have noticed, is that these are all species that are covered by the Animals Scientific Procedures Act of 1986. So, if you're going to do something potentially noxious to an individual in any one of those, invertebrates there, in any one of those classes, you need to provide analgesia. It's worthwhile remembering that, especially if you're working in the exotic pet or the zoological fields, that an animal on which you were working would have protection if you were going to conduct scientific research on it. Many pet owners wouldn't like to think that their precious pet would be having better treatment if it was in a laboratory. So very important just to see how the law thinks about pain in these different classes. So if we think about a fish, as I mentioned earlier, the debate on fish pain still is raging on, but I think people are starting to accept that, yes, fish feel pain. However, our knowledge about pain behaviours in fish, pretty limited. So often it is sort of deviations from the norm rather than specific behaviours that are known to indicate pain. Blunted escape response has been described in both fish and amphibians. So the fish that usually recoils to an alarming stimulus is less likely to do so if it's had a painful procedure performed upon it. There have been other studies using trout and injecting irritant substances into the lips, and you see rubbing of the lips and you see a rocking of the pectoral fins. Again, it's quite hard to know whether these are generalisable or whether they're actually very specific to the particular form of unpleasant procedure that's being carried out. On to amphibians. Almost nothing known. This comes from the laboratory literature, but it is very, very minimal. So still really looking at deviations from the norm, potentially attention to injury. On to reptiles. We know a little bit more about the normal behaviours. In the pet world, actually these species are more likely to be handled, so you might have the opinion and a response to handling of the usual handler, which may give you a little bit more information, but still, knowledge of pain behaviour is very low. As we move towards birds, you can see that with warm-blooded animals, our knowledge starts to become increased. So we have got quite a few pain behaviours described here. Most of these are in parrots or in domestic fowl. And when you think about the difficulty in extrapolating a pain behaviour shown by a mouse to a pain behaviour shown by an elephant, you'll realise that generalising pain behaviour shown by a parrot to an ostrich, a penguin and a sparrow, you may run into problems. But still, at least there is some evidence there and something to look up. And then we get on to mammals, and these are obviously very general signs of pain, and usually a little bit more easy to read. However, we're not just looking at abnormal behaviours. Sometimes we're looking at normal behaviours in abnormal settings as indications of pain. So if we look at these two rabbits, superficially they're doing the same behaviour, so we've got one lying down, we've got both of them in sort of sternal recumbency, looking, well, fairly comfortable. It's only when you start to actually see the pictures that these have been extracted from that you can see that this rabbit here on the right is one of mine shortly after she came from a rescue centre, hence why she's so fat. And this one over here is, has very severe fly strike and is actually lying down, resting on a veterinary surgical table. This is not a normal rabbit behaviour, and then you can tell that there is something really quite wrong with that rabbit. So, let's talk a little bit about our options for analgesia. It's really important, before you do anything unpleasant to an animal, that you do your reading. I know there's very little evidence base, but you can't rule out that there's none unless you check. So, pet animal field, perhaps zoological animal field if there is reliable research, but also in laboratory animal work. Often that is a very, very underused, a very valuable resource in terms of pain and welfare in slightly less familiar species. So, what questions should you ask? I want to do something unpleasant to this animal. How am I going to manage this? First question is, do I have very sound ethical justification for doing this unpleasant procedure to this animal in which I cannot assess pain? Is it going to be in the best interests of the individual? If the answer to that question is yes, then you need to think about some more questions. Is the procedure painful? If I'm not sure, precautionary principle probably is. Is the animal already in pain? Often this is a bit more, you have a little bit more of an idea about whether or not the animal is likely to be painful. You can talk with the owner or the carer or the keeper. What signs of pain will I look for? This is really difficult, especially if there's no evidence base. But at least you can try to think where the position of the pain is. What signs in a similar species might I expect to show? At least have a think about it before you're caught on the hop after doing the surgery. How am I going to provide ongoing analgesia? How long do I think the animal is going to require analgesia for? Both of these two are going to affect your choice of analgesic. And finally, what if it doesn't work? What if I can't keep on top of this animal's pain? What's my plan B? So, let's talk a little bit about analgesic drug categories. List A, these are all drug categories that have got quite a good evidence base in some of our domestic species. So, local anaesthetics, a very, very, very valuable class of drugs, and in fact, the only ones that actually block pain. So, we're not ameliorating pain, we're actually preventing the sensation of pain, causing anaesthesia. They have got cardiac effects at higher doses, so you need to be careful about doses. Again, it's difficult if there's no evidence base. But the great thing about local anaesthetics, if you've got an animal that you can't assess pain in, local anaesthetics will probably give you the only way of assessing whether your analgesic is good enough. And that's because if you give a dose that causes loss of motor function and blocks the motor afferent nerves, then actually you've got a reasonable assumption that it's also blocking the sensory ones. So local anaesthetics are a really valuable category, especially if you've got a more distal injury or an injury where you can use topical anaesthesia more easily. Opioids are again a very widely used analgesic class, especially in birds. There was a paper published 25 years ago looking at kappa opioid receptor expression in pigeons. And so on the basis of that paper, everyone started using butorphanol. I think there's also a little bit of work in parrots. But actually, again, generalising from one species to an entire vertebrate class is quite difficult. So more recently, people have started to be interested in other opioids in birds as well. So do be very careful when you are trying to make sweeping generalisations from very specific studies. Non-steroidal anti-inflammatory drugs are frequently used in laboratory animal work. However, the majority of the species we use in laboratory work are actually herbivorous. So I'd be very careful about using non-steroidals in unfamiliar carnivores due to the risk of renal toxicity. However, they're a very useful class of drugs. Anaesthesia, obviously on here, is not an analgesic per se, but it does cause unconsciousness, so the animals at least won't be suffering. But it's not sufficient to provide any analgesia once the anaesthesia has worn off. List B, these are drugs that have a very limited evidence base in our domestic animal species. However, there's a possibility they might have a role in some less familiar species, but it would still be pretty difficult to justify their use. And now, what happens if you can't find an analgesic that can keep on top of an animal's pain in List A or List B? List C is euthanasia, and this is a very valid treatment option. And if you cannot manage pain, then actually it's probably in the animal's best interests. So how do you choose the kind of drug that you're going to use? You can think about the anatomic location of the pain. Is it on a distal extremity? Is a local block appropriate? You can think about the physiologic quality of the pain. Is it inflammatory based? Is it nerve pain? Visceral pain? How long do I expect the pain to last? Is it going to be a chronic, ongoing pain? Is it going to be surgical pain that's acute and is going to wear off? All of these will help you to decide on an appropriate analgesic regime. So that's the meat of my presentation over. I now want to talk about some of the ethical questions that arise just in the last few minutes of trying to do unpleasant things to animals where you really can't assess pain. So firstly, should I perform a painful procedure upon an animal in which I can't assess pain? If you're going to do this, you have to be very, very sure that what you're doing is in the best interest of the individual. There's also, it might be acceptable if this procedure on this individual is essential for the survival of the species. All of these are questions that I'm not answering for you, but these are questions that you should be thinking about. Where do I draw my ethical line on how much to do to animals? So how about, is it ethical to do something painful to an animal if I'm trying to treat a problem that has been brought about by the keeping of a wild animal in an inappropriate environment? Always ask yourself, who am I benefiting here? Is it the animal? Is it the owner? Is it my boss who needs a little bit more cash? All of these are going to be very valid concerns when you go into your first jobs. Is it okay to withhold analgesia because I'm concerned about the side effects? This is a little hamster that, I think this had a tumour removed actually. This is a photo from a friend. You can actually see we've got some tightness around those eyes as well. Now, I find this argument pretty unnerving because it sounds to me rather like the argument that was destroyed by Nandan Hickey in that paper about neonatal surgery. If you are really concerned about the side effects of an analgesic, then the potential side effects of surgery without analgesia are far worse. So the question should not be, should I give analgesia? The question should be, should I do this surgery? How about this one? There is no evidence for any analgesic efficacy in this species. How should I proceed? Again, this is a really difficult one. So in terms of balancing future gains against present suffering, this becomes a little bit difficult. We cannot take informed consent from an animal, obviously, and we cannot tell them that the situation is going to improve. So with those two problems, balancing or trying to equate future gains, future longevity against present suffering is very difficult. I know that the husbandry of this animal is poor. How should that affect my treatment decisions? This is a very common situation that you're going to see in practice. I'm going to use an example from my own behaviour work. So when I graduated, I set up a YouTube channel and website on rabbit behaviour. Pretty niche, I know. But I've spoken to rabbit owners and vets from all over the world who've had problems with different aspects of rabbit behaviour. And over Christmas, I had a vet call me up and say, I spayed a 6-month-old female rabbit about a week ago. 3 days post-operatively, the owner didn't think she was painful, but she had started biting the owner's father. We're now a week down the line, and no one can handle her. Now, this was a bit of a problem. The rabbit was kept on her own. She had no access to an exercise area and no social interaction unless she was picked up and handled. She'd been bought as a pet for the children, so it's that classic rabbit story. And actually what gets difficult is that most of you will know that if you don't spay a female rabbit, they will develop uterine adenocarcinomas at a very high rate, so by the age of 5 or 6, probably 80% of them have uterine cancer. However, it's quite difficult to justify a very painful procedure that may change behaviour. So this situation I'm describing, I do not think is hormonal. I think it's due to an extremely aversive situation where the animal's lost the tolerance for being handled that was requisite for this animal to be a successful pet, so to speak. So now we have an animal who may have 8 to 10 years of perhaps healthy life, in solitary confinement, potentially unhandleable, and with no access to exercise space. Is that better than having 4 years of life, where the animal has owner contact and is able to have that normal behaviour pattern? If you're not keeping a rabbit with another rabbit, then just neutering for long-term future longevity becomes a little bit harder to defend. So be very careful not to do too much. This owner I spoke with and the vet spoke with, but she wasn't interested in pursuing any way of desensitising this rabbit. And finally, this is a question that's actually very pertinent to my own work. What species should we use for painful research? This is a picture of my friend's Border Terrier puppy, just to really tug on the heartstrings. But if we think about it, we have huge amounts of information on how to assess pain in dogs, and we're instinctively better at it. We have very little information on how to assess pain in pigs. In the UK, laboratory animal research involving dogs is much, much harder. So dogs have this protected status, and actually the majority of people would not want to think of dogs in laboratories. However, we've got at least the hope of controlling severe pain in this one. What species should we use? Okay, so to wrap up my presentation, and also apparently, I don't know what I just did, but that's main loud noise. So before you're going to do something unpleasant to a species in which you can't assess pain, stop. Ask yourself, is this in the best interest of the animal? Do I have very solid ethical justification for going ahead? If the answer is yes, then look and listen. Look at the animal's behaviour, listen to the owner, and continually review to try and give yourself the best possible chance of keeping on top of this animal's pain. 30 years ago, we thought it was acceptable to cut open paralysed babies. I wonder what, in 30 years' time, we're going to think of procedures that we now think are pretty routine. So, thank you very much for listening. This is my YouTube channel, this is my website, and this is my email. If anyone has any problems with rabbit behaviour, please get in touch.
So does anyone have any questions for Dr. Bradbury?
Hi.
When trying to choose analgesia for an animal that doesn't have a licensed drug
Yeah.
for it, do vets typically just try to avoid it at all costs, or will they go on a hunch from a research paper and then seek protection for an off-licensed drug?
So yes, seeking protection from an off-licensed drug is important, but actually with most of these species, you're going to have to seek protection for anything you use because there is very unlikely to be a licensed drug. In practice, so I worked in small animal practice, we would always give analgesia, but that would be based on, usually exotics textbooks will give rough frameworks, so often the range is massive, so you know, meloxicam 0.05 to 0.5 mg per kg, but at least you've got somewhere to start. And realistically, if you have a problem with side effects, there is no licensed drug, so it's, you know, you've done the best thing you can to take control of that animal, but unfortunately that is a risk of this procedure in this animal rather than a risk of the analgesia per se, because the analgesia is kind of part of the procedure. So yes, analgesia would be used. Look at the research, look in the exotics and zoo medicine textbooks. A lot of it is not particularly evidence-based, but at least you've got somewhere to start. Yeah.
What would you tell an owner who seemed to have a bit of an aversion to using analgesics for extended periods of time?
That's quite a difficult one. In my experience, again, I was not in an exotic specific practice. We saw very few diseases in exotics that were likely to cause long-term pain. I don't know whether they just weren't picked up.
Right.
Or not brought in, but usually we would see an animal that was dying,
Right.
or an animal that needed, you know, antibiotic and you know, non-steroidal, and it, you know, with the expectation of recovery. That is quite a difficult one. I'm not actually sure how you go about that. But certainly I've had owners who've had long-term non-steroidal use in rabbits, for example, in very arthritic little old rabbits.
Yeah.
Usually you have to sell it in the right way. So if you say you need to be paying £10 a week for the next 2 years, however long your rabbit lives, unlikely to go down well. If you work together with that owner and say, we really need to be able to keep on top of the pain in this rabbit, how do you manage it? You know, how do you feed it? Is there anything we can do in the environment to change it? And these are your options for managing your pain so the rabbits can be as comfortable as possible, and let the owner and yourself come to a decision. In my experience, most owners are pretty receptive to that. Yeah.
Anything else?
Thank you very much.